I'm Dr. Maury Markman from City of Hope, and I would like to, over the next couple of segments, discuss what I consider to be a very important and somewhat of a neglected topic in terms of what I'm going to ask that we focus on, and that is the distinction between what we call prognostic versus predictive factors in oncology. Let me just start with a definition. And this is not my definition, but I think it's a very good definition. A prognostic factor or biomarker is a clinical or biological characteristic that provides information on the likely patient health outcome, irrespective of the treatment. Conversely, a predictive factor or biomarker is one that indicates the likely benefit to the patient from the treatment compared to their condition at baseline. So the point to be made here is that we use these terms often. And one of the confusions, I think, of describing a predictive versus a prognostic factor is often when we say, oh, this is a prognostic factor, it will help predict an outcome. So we're actually using the word predict to describe prognostic, but in fact, they're very, very different. I'm going to discuss these differences and why I think they're significant, actually more in the next segment. But in this segment, just want to say just a few more words about how we use and how we've used for a long time prognostic factors and predictive factors. In fact, prognostic factors have been around for as long as we've actually seen descriptions or had descriptions of cancer. So localized disease versus metastatic disease. We've known that metastatic disease overall and any cancer type you think about has a worse prognosis than localized disease. We now have and had for quite a while staging systems in all our tumor types that can be really quite extensive. The goal is to help provide the treating doctors, patients and their families, with some idea of the anticipated prognosis based on where we are today. It's important to point out here in this discussion of prognosis, going back to our definition, that is an outcome that is suggested to be poor may lead to the introduction of a variety of therapies, chemotherapy, etc. But there's nothing in this prognostic factor that would say that that treatment will in fact impact favorably that outcome. There's a very much of a distinction between saying what the outcome is likely statistically based on where we are versus information that can help impact that outcome. On the other hand, a predictive factor, which we use widely, increasingly in the area of precision medicine, but this goes back also a long ways. Estrogen receptor positivity or negativity to predict the benefits of hormonal therapy in breast cancer, for example, which has a very long established record, and there are so many other predictive factors we could identify or discuss here. So again, distinction between the prognostic and predictive. It's also important to complete this conversation to say that a particular factor may be both prognostic and predictive. Wonderful example of that, of course, is HER2 overexpression in breast cancer. It has been recognized for a very long period of time that tumors that significantly overexpress, breast tumors that significantly overexpress HER2 have a worse prognosis overall, statistically, than tumors that don't overexpress. So from a prognostic perspective, it's a negative factor. On the other hand, overexpression will predict for the benefits of anti-HER2 therapy, trastuzumab being the first drug and many that follow. So this particular biological factor is used for both prognosis and prediction of potential benefit. That's the introduction. I thank you for your attention. I look forward to discussing the question of predictive versus prognostic factors and their impact today in the next segment.